Welcome to Fertile Minds. My name is Dr. Louise Fay and I'm a fertility specialist with IVFAustralia. Today I'm going to talk about nausea and vomiting in pregnancy. Nausea and vomiting in pregnancy occurs in almost half of women who are pregnant, typically within the first 14 weeks. It usually begins around week 6 of pregnancy and continues to week 12-13. Nausea and vomiting can be severe in some women, and this is called hyperemesis gravidarum. This is quite rare and occurs in approximately 1 in 1,000 women. Some tips to avoid nausea and vomiting in pregnancy and how to manage it. Let's start with non-pharmacological measures. When nausea and vomiting occurs around week 6 or 7, it's usually worse in the morning. However, it is a bit of a misnomer that it's called morning sickness, because it can continue all day for some people and even be worse in the evening time. So when it starts happening to you, the most important thing is to avoid triggers. Triggers can be certain foods, certain smells, certain times of the day. So typically, keep yourself well hydrated. Usually sip fluids. Water is probably best, but if you need to drink other things, that's okay. When nausea and vomiting is worse in the morning, we usually say try to get out of bed quite slowly, take your time. Some people need to have some fluids or a small bite to eat before they get out of bed, and that's okay. Typically, don't brush your teeth directly after eating, as this can trigger nausea as well. Certain food types that might trigger nausea and vomiting are fatty foods, spicy foods, deep fried foods. Sometimes nothing tastes better than a bowl of hot chips that are salty when you've got nausea in pregnancy, and yes, this is okay to eat, but remember just to eat small amounts. A very full stomach will trigger more nausea. Some supplements that we do recommend taking in early pregnancy, for example, iodine and folate, may come in a multivitamin, and quite often the coating and iron supplement can aggravate your nausea and vomiting, so it's okay to stop taking these type of multivitamins just while the nausea and vomiting is at its peak and just get a separate supplement of iodine and folate by itself. Women may need medical treatment, and usually the first port of call is their GP to discuss the degree of nausea and vomiting. There are other things that can cause nausea and vomiting in pregnancy, so if it's quite getting worse, we usually recommend that women see their GP to seek medical advice to outrule other causes of nausea and vomiting. The most common cause is typically a urinary tract infection or UTI. Women with severe nausea and vomiting may need hospital admission for IV fluids, for medication that will stop vomiting, and for ongoing care. Non-pharmacological methods of treating nausea and vomiting, other than the dietary advice that I just discussed, would be things like using ginger, taking the B vitamin complexes, acupuncture can help, acupressure bands can help, and some of these together may all help the clinical picture. Pharmacological methods are usually taken under the guidance of your GP, or sometimes you may be continuing to see your fertility specialist for early pregnancy care, or you might have booked in with an obstetrician or a midwife already. There's good resources available, and MotherSafe in Sydney is a very good resource for taking medication in early pregnancy. In general, medication for nausea and vomiting is very safe to use. It's prescribed under the guidance of your medical doctor and will always be prescribed in the context of early pregnancy and drug safety in pregnancy. If nausea and vomiting becomes a point where you can't keep anything down, you're vomiting, you feel dehydrated, it's very important that you attend for medical advice. Usually, a local maternity hospital will have a unit that has treatment advice for women with severe nausea and vomiting in pregnancy. It's important not to ignore these symptoms and to assume that it's very normal for pregnancy. Rehydration is key for your well-being and for the ongoing care of your pregnancy. Thanks for watching. To stay up to date on fertility, don't forget to subscribe to our YouTube channel.